Okay, looks like everything's slowed down here in terms of people coming in, so we're going to go ahead and get started so I can be respectful of everyone's time. So welcome. I appreciate all of you attending today's class. This is an instructional class I'm going to give regarding your Part D drug card. So my assumption here is that most of you have Medicare supplements along with a Part D drug card. And this is all about how we're going to look at our Part D drug cards during the upcoming annual election period and make sure we're either enrolling in or staying in the one that's going to fit our situation the best. So class topics today we're going to go over include sort of an update on where drug cards are, where your Part D drug cards are in 2026. How did we get here? What's some of the environment, some of the rules that have made this more difficult for all of us? And then I'm going to give a live overview of the Medicare.gov shopping tool so that you all know how to find the right drug card when we get into the annual election period. Okay, so what are some things that have recently happened with our drug cards? Well, a couple of big changes got implemented in 2025, and they all go back, really, most of them go back to the Inflation Reduction Act, okay? So the first thing, really big thing that happened in 2025 was that the government introduced this $2,000 maximum out-of-pocket limit. What that means is that for enrollees, if you were to spend $2,000 on your medications during the course of the calendar year, then your insurance carrier, your Part D drug card, is going to be required to cover all the costs of your medications after you spend that $2,000. And in many cases, the way the rules work, you didn't even need to spend $2,000. It was kind of a joint combination of what you spent and the type of discounts and the amount that your drug card spent toward you. Once that number really hit $2,000, you're supposed to be off the hook and all your medications covered at 100% above that number. That max out-of-pocket limit has never existed before. So before 2025, you were on the hook for an unlimited amount of money toward the cost of your medications. So a big change there. Next change that happened was the government introduced what I call the copay smoothing program. So, normally if you went to I'm getting some feedback here that people cannot hear me. Let's see. Debbie Staley, I can see you. Can you give me a thumbs up if you can hear my audio? Okay, thumbs up. So whoever just wrote in on the chat, it appears to be something with speakers on your end. Okay, so copay smoothing program, right? Basically, if you had a very expensive medication before 2025 and you went to your pharmacy to get it, they would ask you for the entire amount right there at the point of sale. But what this copay smoothing program allows you to do is go into your pharmacy, and if your medication was, let's just say $1,200, you're going to be able to tell that pharmacist, hey, I want to opt into my drug card smoothing program, and you walk out of there and you don't pay anything at the point of sale. But then what happens is they take that $1,200 and they divide it, that total, among the number of months that are left in the year, and they start giving you monthly bills. Let's say we did this in January or we did it in December. We've got 12 months, $1,200 worth of medications. I'm now going to get a bill each month for $100, okay? So it was a way for enrollees to sort of finance with no interest the cost of that first or second big medication cost, or whenever it is you got it. You could opt into this program at any time. It didn't have to be your first fill, okay? So what did these things do? Well, as you can imagine, it put a lot of increased cost pressure on the Part D drug cards, and really that $2,000 max out of pocket is a big change, right? So your Part D drug card now is contributing a lot more money overall to the cost of everyone's medications. So what are some things that happened? Well, one of the things is we're now dealing, and are going to continue to deal with, more restrictive formularies. So a formulary is a list of medications that your Part D drug card is going to be willing to cover. So we've seen those formularies shrink, right? So maybe they remove some of the more expensive medications from their formulary, maybe they moved some medications that were in lower tiers to higher tiers. So maybe we had a tier 2 medication on our drug card and that's got dropped down to tier 3 or tier 4. The higher the tier you have, the more expensive your medication is going to be, right? So just been some tightening up of the formularies overall. Another thing that happened, we're losing the number of options we have for our Part D drug cards, right? So if we go back a few years ago, there were 6 or 7 drug card companies. Each of them were offering at least 2 Part D drug cards. So we had a lot of options to choose from. So now, that's shrinking. We had a company leave this year. We know coming up, there's going to be a company that drops out, right? And so for the ones that are staying, they're really reducing the number of drug cards they offer. Instead of 3, maybe it's 2. If they offered 2, maybe now it's 1. Right? So we just got fewer drug cards overall to choose from here. And then, as you can imagine, the insurance companies aren't really excited about somebody enrolling in their drug card because they don't really have all the actuarial data yet. Right? It takes them a couple of years to figure out these increased costs, but they know they're on the hook for a lot more. So when they're not excited about getting people to enroll, one of the things they can do is stop dealing with brokers, right? So brokers, agents like myself, we're a sales channel. We help people and guide them into the right drug card. Well, they're not really incented to work with brokers to get people enrolled in the drug card, right? So this year, as it currently stands, we've got 6 drug card companies. As of July 1st, 4 of them had decided they're no longer dealing with brokers. So that left 2. We know that one of those remaining 2 is just dropping out of the market completely. And so that leaves 1. And our expectation is when we get into open enrollment, that 1 remaining drug card will also no longer work with brokers. So the idea here is you don't want somebody, even if it's 1 drug card, and you're working with a broker, you want to be able to shop all of the drug cards, not just the one that's going to pay us, commission for getting you enrolled. So we want to make sure you guys get the right thing here, not just the one that's going to work with brokers, if any at all. So that's going to bring us to, how do we do this ourselves? And I thought what I would do here is walk everyone through the main tool, impartial tool, for looking at your Part D drug card. So hopefully everybody can see this in the browser. This is medicare.gov.gov. I really want to encourage everybody, if you've never been out to this website, you haven't got a login, really you need to create your username and password and get yourself an account here, okay? Specifically for this Part D drug card shopping, it can make things a lot easier on you. And we're going to go through why some of that is. And I'm going to show you now, this is just a screenshot of somebody that has logged in, right? And what you're going to notice here is that there's a list of medications already, right? So when we think about, we're going to use this tool to shop out our Part D drug card, we have a couple of different ways we can do it. We can certainly just use the public website. We don't log in, but then we're going to have to enter in all of our medications. But if we got a login, Medicare actually has the history from your drug card, and they'll pull back the list. So you don't have to do as much manual entering of the medication list. That's one of the whole ideas. And there's some other benefits to Medicare.gov. You can get your explanation of benefits, or what they call a Medicare summary notice. How did your claim get paid? You can look at all of that there. There's billing information. But for our purposes today, this is about having a login so we can look at our Part D drug cards. So here's our medication list. And I want you to pay attention down here at the bottom to a couple of buttons. One says edit my drug list, and the other says add recently filled drugs. So let's just say we look at our list and we don't take this rosuvastatin calcium anymore, right? So we got 3 medications here. We don't take rosuvastatin calcium. We need to get that off the list. We would just click this blue edit my drug list, and then we're going to be able to change. We can remove, we can change the dosage, we can edit the existing list. But let's say all these medications are correct. We're still on all these, but there's one, that I just recently filled and it hasn't had a chance to feed over to the system. There's another button here that says add recently filled drugs. So we would click that. And then we're going to be able to add drugs. I'm going to walk you guys through how the website lets us do that, right? But this is just showing you, here's what somebody's login looks like. And it can make it a lot easier to look at the drug card because part of it's already done. Let's go back to our browser. And some of these steps are going to be the same whether you've decided to log in or not, right? So let's imagine you've logged in. The same step as somebody who does not log in. You're going to see this link up here that says Health and Drug Plans up in the top right. When you click that, you're going to get a menu item that drops down. And over here on the left, under Find and Compare, there's a link that says Find Health and Drug Plans. And this is where we really want to head. This is going to get us to our shopping tool. So I'm going to click that, Find Health and Drug Plans. Now, if you have logged in, I do not believe you get this step because they already have your address information. But if you've not logged in, you're using the public face site, no problem. Just going to type in a zip code here and then click this Continue button. Now, whether you're logged in or not, it's going to ask you, what are you here to do? What are you looking for? And I want to be clear here. I believe everybody on my list has a supplement and a drug card. So what we are looking at is the Part D drug card, D for drugs. So they call it Medicare drug plan. It's this option in the middle. All right, so whether you are logged in or not, they're going to ask you what you want to look at, and you want to make sure you're looking at this Part D drug plan, Medicare drug plan Part D. I'm going to click that, circle my selection, and I'm going to click this Find Plans button. Now, if you're logged in, I do not believe you see this next screen. This is a screen that says, really based on your income, do you receive any help from the government to lower the cost of your medications? Right? An example, somebody on Medicaid, or if you're receiving supplemental security income, you're getting extra help with your drug costs. These are all low-income programs for people to help with their medication costs. If you're logged in, I believe they know that already. If you know you're in one of these, you can click the button. The majority of you, I feel I'm pretty confident, you would click this, I don't get any help from any of these programs. And click Continue. Now, here we are. It says, do you want to enter your medication list, right? Basically, how do you want me to shop for your drug card and tell you what the right one is? So we're going to say, yeah, of course, we've got some medications we want to enter here. We'd say yes, and then click the Next button. Now, if you logged in and you saw your list and then said you wanted to edit that list, or you want to add new drugs, this is really what you're going to come to. Right? So this is the box where we start typing in our medications. And what's neat about this is when you start typing your med, it's going to bring down a drop down that matches what you've typed so far. Okay. I know Eliquis is one of the more popular brand drugs. It's expensive, so I'm going to say yes, right here up at the top. For my drop down, you can see all these available medications. So I'm going to click on Eliquis. And then there's this green button that says Add Drug. Now, you got to drop down for the type of dosage you might be using. It will kind of default to the most frequently prescribed dosage, in this case, Eliquis 5 milligrams, and the quantity and frequency of your fill. So most people get 60 5 milligram tablets of Eliquis every month. You're using mail order, I can change that. Hey, I get 180 every 3 months. So it's important when you go into this, have your medication list ready. Know whether you're taking brand or generic so you can type the right name in. Know what the dosage is. In this case, is it 5 milligrams? Is it 2.5 milligrams? There's going to be a dosage on your medication. Know how you get it filled, right? Are you getting a 90-day supply? Are you just getting it once a month? How many times do you take it a day, right? So know that information, get it entered in there correctly, and then click the add to my drug list. And you'll see that we'll start to build out our drug list here. Let's say I've got another drug that I'm on. It is rosuvastatin. Again, you can see I start typing. Going to come up with a list, select from that drop down and say add drug. Yep, rosuvastatin, I don't take the 20, I take the 10. Get that 60 every month, add to my drug list, right? You click that you're done, you'll see your drug list start to fill up here. So you can edit it, you can remove drugs, you see remove drug there. So if you put in something you no longer take, you need to edit your drug list. I put in the wrong dosage, wrong frequency, you can edit there. You want to make sure that this drug list is now accurate. I had a question come in that says, if you are logged in, is your drug list, does that come up? Yes. So if you log in with your username and password, at least the medications that they've had time to know about will automatically feed into this list. And then you can edit, remove, change, whatever you need to do to that drug list. But let's pretend these are the 2 drugs that I'm going to take this year. And now, once I have this list ready, I click Done Adding Drugs, this green button down here. Now we're to a section where you can start putting in the pharmacy that you want to take. So as a heads up, not all drug cards cover every pharmacy under the sun. Some of them will have in-network pharmacies, and each of them will have preferred pharmacies, right? So you're always getting your lowest cost at a preferred pharmacy. But let's say I'm willing to use Publix and CVS. I will note here that the exact address, the street address, it doesn't really matter, right? CVS in Chesterfield is going to start charge the same prices as a CVS in the West End. So the street address doesn't really matter. Just make sure you're getting your right pharmacy. You can see down here, your pharmacy list begins to build in a lower row. All right, you can add up to 5 pharmacies. Once you get your pharmacies set the way you want them, there's this continue to view plans button all the way over here on the right. Click that, and now we're to the results. Now we're going to go through it. I'm going to tell you a lot of information about the results, but I'm going to sort of speed through these steps real quick one more time, just to make sure everybody got them, right? So let's pretend we're at Medicare.gov. We're up here at the health and drug plans. Click that, then find health and drug plans link. Type in your zip code if you're not logged in. If you are logged in, you shouldn't need to do that. Choose that Medicare Part D drug card option. Click find plans. Everybody will need to do that piece. Select if you get any financial assistance from the government to lower the cost of your plans. And this is where we're entering our drugs. Once we're done that, we click Done Adding Drugs. We enter our pharmacies and then continue to view plans. So hopefully everybody's comfortable now sort of navigating this website. How do I enter my drugs? How do I tell it what I want it to show me? Okay, so now all of these drug cards are searched and sorted, and the tool comes back and says, what's the right drug card for you from a total out-of-pocket cost standpoint? So let's think about that phrase, total out-of-pocket cost. So it's taking your monthly premium of your drug card, right? How much is the insurance cost you for your Part D? It's multiplying that by the number of months we have left in the year. And then it's adding in the projected cost for the medication list that you provided. Now, I want to note here that since we're in September, the tool is only capable right now of making a calculation for October, November, and December. So this is showing us what's the best drug card for the remaining 3 months of the calendar year. When you guys start to do this during the annual election period, October to December 7th, then it's going to be calculating the entire 2026 year. Okay. All right, so we've got these results. It's searched and sorted, and this is the, in my opinion, one of the more important numbers, estimated total drug plus premium cost. So all in, how do we get our total to be the lowest? That's what the tool is calculating. Okay. Now, you can see this drug card monthly costs $84.30. So the remaining amount is our medication cost. I would say for most people, you know, these Part D drug cards are one of the few insurances we get to pick based on the situation we know, right? You go get auto insurance and you don't know if you're going to get into a wreck. But if you're getting medication coverage, medication insurance, Part D, at least at the moment, you know what medications you're on. This gives us the ability to pick the drug card based on, at least at the moment, what we know we're taking. Okay. Again, for most people, our recommendation would be take the one that lowers your overall cost the best. I'm going to give you a caveat here, and let's look right here at this star rating. Okay. So Medicare surveys Medicare enrollees. They get feedback on how these companies handle coverage for the Part D program, and then they assign a star rating, 1 to 5. We don't have any 5-star drug cards right now in 2025. We don't have a 4-star drug card right now in 2025. The highest rated drug card we've got in Virginia, at least, is 3.5. So that's the best drug card, at least by Medicare standards. That's what Medicare would say, that's your best available drug card in terms of customer feedback. Historically, I have not been comfortable recommending a drug card that did not rate at least 3 stars by Medicare. So that's sort of been my minimum, right? So 3, 3.5, 4, 5, they're available. That's what I like to put people in. So we look at this and we say, okay, this AARP preferred drug card lowers my cost the most, but looks like Medicare's got some feedback that maybe it's not the smoothest drug card in the world to deal with. So what do? Well, maybe we scroll down to the next one. And how much more does that cost us? Well, again, we're looking at this line and it says if I choose this drug card, the rest of the year is going to run me $450.63. That's about $42 more than the AARP drug card. But let's look, the star rating now is 3.5. So the question you got to answer for yourself, and nobody can answer this for you, but is that higher rated drug card, does that provide some comfort? Does it provide some value? Does it maybe make things a little bit easier if you do get a prescription you're unaware of during the year? Is that drug card going to be a little easier to deal with? Everybody's got to decide that for themselves. If I'm looking at this over the course of 12 months, which is what you'll be doing, then I would maybe make the argument that, hey, for $42 for the year, you probably ought to go with the higher rated drug card, right? And there's going to be a limit there. So let's say that was $1,000 more for the year. Well, I'm not so sure, right? I'm not so sure at that point. But $42, almost certainly. $100, probably. $300, $400, $500, you know, maybe we're getting on the fence there. Okay. So those would be the 2 criteria that I would recommend that you do. After you've entered in your medications, after you've entered in your pharmacy, look at the total estimated cost and then the star rating and make a decision for yourself.
What is the deductible?
The deductible on this particular drug card is $0. The deductible on this drug card is $590. However, However, that $590 deductible is calculated into this $450.63. Okay, so that is not a separate cost. If there's any drugs on that formulary that require you to meet the deductible first, it is included in that calculation. Okay, so let's say we're interested in this WellCare Value Plus Part D drug card, and now we want to click on these plan details. I want to see a little bit more of the meat and potatoes about the drug card. So here's our monthly premium, $102.30. There's the deductible. Start getting into some information about the pharmacies. So both Publix and CVS are in network and preferred. Here's how much the tool is telling us we're going to spend on the medications at each pharmacy, and this is going to be an annual calculation, right? So I get this drug card, and then I go to Publix and I pick up Eliquis. Over the next 3 months, it's going to run me $131. Over the next 3 months, rosuvastatin is going to run me $12, right? Again, your calculation will be showing you the whole 12 months. Here's the estimated premium costs and drug costs over the course of the remaining year at each pharmacy. You can drill down, you can click on these pharmacy names. It will give you, retail cost of the medication. What is just the medication cost without insurance? You can find that information out. And then here, click this button that says view more drug coverage. It'll tell you what tier the medication's in. So tier 3, Eliquis, tier 2, rosuvastatin. Remember, the lower the tier, the lower your cost is going to be. Okay, so a lot of good information about sort of the details of the drug card there. When we're done, we reviewed, we're comfortable, we can click this back to search results link up here at the top. And now I'm back to where it's searched and sorted all the drug cards. And you can get an idea of how significant this could be, right? So if our least too expensive are $408 and $450, we start scrolling down, okay, and go to the next page. There's a bunch of these drug cards this year. Look at this, nearly twice as much. So if I'm in the Cigna Healthcare Assurance drug card and I don't look, then I'm paying $500 more than I need to for my list of medications over the next 3 months. So you can imagine what that might look like if it's over a 12-month period. So this is why it's important to look at the drug cards. I'm going to stop here for a second. I've got some questions that have come in that I want to, quite a few. Let's see. All right. Do you need a list of occasional scripts, i.e. an antibiotic, not a regular drug? So if it's something you've taken in the past, it's not a bad idea to enter it. And you can just say, hey, I pick this up once every 12 months, right? You don't have to put in there that you get it every single month. It has an option in the dropdown for once a year. And that just ensures that it's on the drug cards formulary. It's a way to make sure of that. Next question, do all plans do copay smoothing, and is that shown in the cost? So yes, all Part D drug cards are required to offer the smoothing program. It's not really, it's shown in the cost because it doesn't really change your cost, right? You're going to pay the amount that was owed. It's just whether you pay it all up in one lump sum or whether you're going to pay it over the course of the however many months are left in the year. So when I see this $408.90, it doesn't matter whether I pay all of that at the pharmacy at one time, or I go to my pharmacy, I don't pay anything, and then it divides that amount by the number of months that are left. My cost is still $408.90. So the smoothing program does not save you any money in the end. It's a way for you to budget and spread the upfront cost out. Another question, I don't take regular prescriptions. My worry is if I get cancer or something with very expensive drugs, and I capped at $2,000 for all these plans for all drugs. The $2,000 cap is in effect as long as the medication is on your drug card's formulary. So, there is no drug card, no matter how much you want to pay for it, that covers all the medication under the sun. That drug card does not exist. So inherent in the way Part D works is that you could pick a drug card and then the next day you could go get prescribed a medication. That is not in your drug cards formulary. That is just the nature of the program. In terms of cancer, if you're referencing inpatient chemotherapy, just remember if you're getting infusions and things like that, that's covered by your medical side. So Part B and then your supplement would handle those charges. All right, does the total include the deductible? Yes. So when you see this total here, $450.63, that includes any amount of this deductible that you have to meet. That is built into the cost. Consider the large deductible in the second plan. Yes, again, sorry this is confusing, but that deductible, any amounts you have to meet toward the deductible is already calculated into that total drug and premium cost. So don't add that in, don't let that throw you. Whatever the total here, drug and premium cost is, it is including any deductible you have to meet. Is the premium based on the drug list provided? So this monthly cost here, monthly premium, that is just the cost of the drug card, whether you have 0 drugs or whether you have 1 million drugs. You sign up for this drug card, no matter who you are, the premium is going to be $102.30. The variable in all this is what are your medication list and how much are those going to be on that particular drug card. Another question about the deductible. WellCare always have to pay deductible first for tier 3 and tier 4. Yes, that is true. Most of these drug cards will make you pay a deductible before getting a tier 3 or tier 4 medication, right? But again, when you're shopping, deductible built into this cost. What if a drug is not covered? If it is not on your drug card's formulary, then you will pay cash for that. It will not go toward any deductible. It will not go to the $2,000 maximum out of pocket. We will be doing this in October for 2026. Can the program show us total cost for 2026? Yes. So starting October 1st, this program is going to give you the ability to look at all the 2026 drug cards, and it will calculate based on calendar year 2026. You have a window starting October 1st to October 14th where you can shop around with this, right? Look at the drug cards for 2026. You can't enroll yet. The enrollment does not start until October 15th. And I want to caution you here, I have seen before where the initial sort of data dump that Medicare gets for the new year, and it might not be right October 1st, might not be right October 10th. Sometimes I've seen it not right October 15th, but at least, you've got a better chance. If you want to hop on there between the 1st and the 14th and sort of shop it around, it's not going to hurt anything, but I would definitely double check those results starting on the 15th, because sometimes they can be updated. Okay, if one of my drugs entered is not covered, will I be told that? Yes. So let me enter a drug that we know is not covered here, right? So Zepbound. It's available as an option. I'm going to click a dosage. I pick up one of these pens. All right, see how much our cost has gone up here? I added that Zepbound. Why is that? Because if we scroll down, it's going to tell us not covered right there in yellow. Right, so it's just going to say you're paying full retail costs for Zepbound if you go get it. Is there a website that lets you check multiple discount cards, not Part D prices for medications, or do you have to do them one at a time? I am not aware of any aggregator for these programs, savings programs like GoodRx, Single Care. I have some people use Canadian pharmacies. Mark Cuban Online Cost Plus is a good resource as well. So I don't know of any website that you can check all those sort of discount programs. I do want to say those discount programs are great. I use GoodRx myself quite often. just remember any amount you spend using something like GoodRx, it's not running through your insurance. So that means it is not accumulating toward that $2,000 maximum out of pocket. So they can be very handy in a lot of situations, but don't let it mess you up. If you're really accumulating toward that max out of pocket, anything you use for those discount programs is not going to count toward that. WellCare Value drug card has a $0 premium. Is it worth it? Again, that's one of the more popular drug cards. They were really good this year, had a nice formulary, 0 premium. It's based on your particular list of medications though. Any of these drug cards, whether it's the WellCare at 0 or AARP at 100, does it cover the list of medications we know about? That's the most important question. I got a hard copy from WellCare Value and no premium. Where did you get the 102 premium? So WellCare currently this year has a few different versions of their drug card. The value is a $0 premium. This value plus in 2025 is 102.30. So it's a different drug card. WellCare has multiple drug cards. Next question, if we decide to keep our current plan D, do we have to do anything? You do not, for most of you. However, we know one of the big 6 drug cards is not going to be available next year. They are leaving the market. I am legally not able to tell you which one of the 6 that is, but if you're on that drug card, you're going to get notice in the mail. They're going to tell you, hey, you had our drug card this year, we're out of here. They will not automatically enroll you in another drug card. So if you're in the one that is not returning, you need to go out and use this tool and proactively enroll in one that is staying around. It's not all of them. Okay, are there any medications that are uncovered by some plans and covered by others? For sure, that is exactly why you use this tool, because different drug cards have different formularies, and you will find some that cover some medications that others do not. What about the deductible? I think I've answered that question. If I get sick during the plan year and the drug I need is not on the formulary, what do I do if the drug is $5,000 per month and I have no coverage? My wife ran into this year and she stays sick and seems to have no recourse. So this is, again, a difficult proposition because you're stuck in the drug card for the calendar year in which you have it. I want to reiterate, there is no drug card you can buy that will cover every medication under the sun. That drug card does not exist. So you could have been in any one of these drug cards and there was the possibility you get prescribed something that is not covered by your drug card. Now, they are supposed to provide options for every therapeutic category. So while it might not be the specific one that the doctor's prescribing, there has to be something on that list that will provide therapeutics for whatever the condition is. And then aside from that, if there's documentation, there's always an appeal process. So if you can say, hey, this medication you want me to cover that's on the formulary, it doesn't work for me, and here's why, here's the doctor records, here's what happens when I take it. There's an appeal process. And if you can prove that the medication that they're willing to cover doesn't work, then you can potentially get that added as sort of a special exemption for you to get that on the formulary and get it covered. Another question, if my drug isn't covered, is there still a $2,000 limit on what I pay for everything during the calendar year? No, if your medication is not on your drug card's formulary, it will not accumulate toward the $2,000. Next question, why did the other WellCare cards not show up? Well, they do show up, they're just further down the list in terms of total cost, right? Here's the WellCare Value that's very popular, 0. But with only 3, remember it's doing the calculation for 3 months. So it's saying, hey, do you really want to spend over 3 months, meet the full calendar year deductible, right? So that's why this looks a little skewed. This will look different when you do it for all of 2026. Please explain the late enrollment penalty fee. Our Medicare Part D lapsed in February and we need to re-enroll. The late enrollment penalty is 1% of the national average of drug cards for every month you go without coverage. So that's roughly 40 cents, give or take. So for every month you didn't have coverage, multiply that by 40 cents, and that's going to be your monthly late enrollment penalty going forward. Next question, should I be able to see the medications I'm currently taking on the Medicare.gov website? Yes, if you log in with your username and password, your current medication list should be available right there. Next question, is the $2,000 Medicare drug cap going away? No, it is not. It is increasing, so we know for 2026 it's going to be $2,100. Next question, will WellCare have the $0 premium in 2026? I think you answered it, but I missed what you said. Yes, based on what we're hearing, the $0 value, WellCare value will continue to be $0 premium next year. It will not be in concrete until October 1st. Next question, how do you find out what the options are if they don't cover it? I go to CVS and they just say not covered. Well, again, there's got to be, if it's just not on the formulary, the question is, did they have an alternative for you that is on the formulary that will work? And if it will not, then why is it not working for you? And can we make an appeal to get that medication that they're not covering? And we appeal to get that added and get an exemption. Should we go ahead and edit our drug list now so it's ready for 2026? Hey, I would say, yeah, if you got your login, and this is true whether you have a login or not, you can go ahead and play with this website just like I'm doing it, right? So if you want to be comfortable with navigating it, you can go out and you can use the public site, enter in some dummy medications, look at the results. 2026 won't be out there until the 1st, okay? But you can go ahead and play with all this. I want everyone to be on notice for receiving what's called your annual notice of change, or ANOC, in the mail. The carriers are supposed to have that to you all no later than the end of this month, so before October 1st. It's going to show you how your drug card is changing, what the premium might be going to, you know, any drugs that they were covered that you have that are not going to be covered. Next question, I am not on any drugs. Do I have to sign up? Nobody can make you get a drug card, but if you do not use this window to sign up, then you won't get another opportunity until the next annual election period. So, you know, once you let December 8th come and go, there is no opportunity to get a drug card, and you are accruing a late enrollment penalty. Will the company that is leaving the marketplace be general knowledge at some point? Yes. So October 1st, it will be clear, and then I can legally tell you what drug card is, what company is leaving the drug card market. But you know, there's 6 now, so when you go on October 1st, you only see 5. You'll know the one that's out of here. I got a question that says, will the company that's not, I'm not, what company is leaving? Okay, yeah. Yeah, I'm in notice. It's, yeah, 108 page long for your annual notice of change. Yep. All right. So now what do? We found the drug card. Let's say we like this 3.5-star drug card. We want to get enrolled. You got a couple options here. You can go ahead and click this green enroll button. I'm not going to click this join plan button right now because we're not in the annual election period, and it's going to start asking me a bunch of questions that you all will not see when you get into open enrollment. But if you wanted that drug card, click the enroll button and click join plan. You're off and running. If you're logged in, they'll have most of your information in there already. If you're not logged in, you'll have to enter your Medicare number, your address. You will eventually get to a point where it says, how do you want to pay the monthly premium for the drug card? Just a personal preference here. I do not love the Social Security withdrawal method. That leads to a lot of confusion. Sometimes it takes Social Security 2 or 3 months to link up with your drug card. So then people sign up, they think they've got Social Security withdrawal, but then they're getting a bill. Why am I getting a bill? Do I have to pay it? I'm not going to pay it. Then they start getting late notices. So I don't love that method. Either do manual monthly bill or enroll in the carriers, the insurance company's auto draft, once you get yourself enrolled. Okay? All right, again, October 15th through December 7th is your enrollment window. So go ahead, register that account on Medicare.gov, review that annual notice of change, have your medication list ready. know those dosages and frequencies, and play around with the tool. Okay. Now, if you're doing all this yourself and then it just looks like Groot to you, like I can't figure this out, Chris, I don't know what to do, this is confusing, we're going to be available for some phone calls and some support. So you can call me and ask, and we'll do the best we can. It's just going to be carriers that made it impossible for us to proactively do all this for you. I want to clarify, this is only related to the Part D drug card annual shopping. That's it. So for everything else we do and have always done for you guys, sign up new people for your supplements, shop those out, Medicare Advantage plans, annually shopping those, new enrollees into drug cards, we're still doing that if we're helping somebody new to Medicare. So everything else we've always done stays the same. This change this year, I want to reiterate, it's just this year. As we've seen, Medicare changes a lot. Who knows what next year is going to be, but this is the method for this year. It's only related to the annual reshopping of the Part D drug card only. The only thing we're kind of having the enrollees handle. Okay. All right. Really appreciate everybody coming. Hopefully this was helpful for you. I've got a few more questions. I'm going to hang out. If you're not comfortable or you don't know how to use the chat box, feel free to unmute yourself. You should be able to have that functionality, and I'll hang on the phone for as long as it takes to get everybody's questions answered. So another question about the late enrollment penalty. If I wait until open enrollment, will I still have the fee? Yes. So you are accruing the late enrollment penalty. Every month you go without coverage. Is it best to enroll now? You probably can't enroll now, right? So if you lost your coverage, you've got to wait for the October to December timeframe to enroll with the new plan starting January 1st. Next question. So you can't make money on the commissions anymore, so we're going to have to do this for ourselves this year. So for, yes, again, this year, the drug cards are not dealing with brokers on these enrollments. That's why I'm holding this class. I'll be sending this out as a YouTube video to everybody as well. So if you miss something in here, there's going to be a recording headed your way. We will also be posting this link to our website as well. If I made no changes, must I re-enroll? If your drug card is staying in the market, then you can just take the auto enrollment. Okay, but again, one's leaving, one of the big ones is leaving, so make sure you're paying attention to your notices in the mail. I appreciate the kind feedback from everybody. Again, thank you all for coming.
Thank you.
Thank you. Appreciate it.
Thanks, Chris.
Thank you, Chris.
Thank you. Thanks. Take care, guys.
Bye.
Appreciate it.
Thank you.
Yes, sir. Thank you.
Have a great one, Chris.
You too. Thank you so much.
You know, he used to work in Shelley's office. He started with Mass Mutual.
Hey, Chris.
Yes, sir.
So I'm still working, but started drawing Social Security. So I was automatically enrolled in Medicare. I have not used it. When I finally retire and I no longer have coverage through a company, I assume there's a grace period of signing up, even if it's after the normal sign-up period in the year. Is that correct?
Yes. So that would be a involuntary loss of your employer coverage, which would grant you the right to pick up supplements and drug cards and anything additional you wanted to go along with your A and B. Now, you're drawing Social Security, so they automatically enrolled you in both Part A and Part B. So you're paying for Part B, excuse me,
No.
and your employer plan?
No, it's just A only.
Just A only. Okay. Yeah. No problems at all then. When you turn, when you're ready to retire or come off that employer plan, we typically like to start working with somebody about, ideally 4 months or so before we, you're going to retire.
Okay. I'll connect to you. Maureen already works with you now, and I'll connect with you as I nail down that date.
Sounds good. We look forward to helping you.
Good deal. Thank you.
Thank you. Take care.
Maureen says hi.
Hey, Maureen. Thanks.
Take care.
Thank you.